All right, wonderful. We're going to get started because it looks like the people joining are slowing down and I want to keep us on time. My name is Molly DeMarco. I'm our team lead here at UNC with our SNAP-Ed Toolkit team and also on ASNA's Race, Health, and Social Equity Committee. We're so excited to have at least over 500 people here today, and this is one of the first of a number of webinars that we're going to be doing over this coming year. We're going to actually start out by doing a quick poll. So we're going to switch so that that may happen. You can participate with the link in the chat. All right, look at all those words, y'all. Thanks so much for participating. Looks great. Thank you. All right, so moving on, before we get started, we wanted to do a couple of things, including a land acknowledgement. And I'm going to read this and you can see more information about where it came from. We gather for this webinar from different places, but all on the traditional lands of Indigenous peoples, past and present. We honor with gratitude the land itself and the people who have stewarded it throughout the generations. This calls us to commit to continuing to learn how to be better stewards of the land we inhabit and the practices in which we engage. We also, before we get started, wanted to share some discussion agreements, and there's more information about this as well. But we wanted to note that for this webinar, we are not having open discussions about the question or challenging the existence of racism itself. We believe that racism, injustice, and inequity exist. This webinar is not a place to question the validity or learning about the validity of learning about race, racism, equity, or white supremacy. We encourage you to share your learnings, reflections, and truths using I statements in your poll answers whenever possible, focusing on your own experiences and understandings. And treat each other with respect, honesty, appreciation, and grace whenever possible. We know that we're all in different places along this journey. You're welcome to contact me if you want to discuss any of the discussions that go on today. A little bit of housekeeping before we get started. This webinar has been approved to provide dietetics CUs, 1.25 credits. You'll receive your certificate at the end of this. It will be emailed to you. If you happen to be watching this later, you can email the address on this screen to get a certificate. We will be using the Q&A for our questions, so I encourage you to put your questions there. The chat will only be to communicate with the hosts and the panelists. Also, live captioning is available for everyone. If you click there in the bottom where it says live captioning or live transcript, it has a CC, you can turn that on for yourself. This training is being recorded. It will be posted on all 3 of the host sites. Those who are registered will receive an email with those links following this training. We will also be sharing the Q&A and the reflections that were shared in the same places that we share the slides and the recording. Just a little bit of information on our 3 objectives for today. We are planning to develop a shared definition of racial equity and an understanding of the importance of such a focus for SNAP-Ed. We want to identify ways community engagement can be used to advance racial equity within SNAP-Ed and foster a culture within SNAP-Ed of dialogue and activity to advance equity. Just an outline for today. We're excited to have Deputy Undersecretary Stacy Dean with us, and she's going to provide an overview of the USDA's equity focus. Then Latrice Davenport will be sharing some information just to frame the issue for us today. And both Mary Marchek and Stephanie Parker will be talking about their experiences working to do community engagement to advance equity. We'll have some reflections at the end and a couple more polls, and then we will do Q&A and we'll wrap up for the day. I would like to turn it over to Undersecretary Stacy Dean to provide a few remarks for us. And thank you so much for being here.
Oh, thank you, Molly. I really appreciate it. Hi, everyone. I am Stacy Dean, and thank you for having me here today to kick off this crucial training session. And thanks to all of you, really just vital partners, for bringing us to your table. This is a pivotal time for SNAP education, one that offers an opportunity to rethink how the program approaches serving those in need. It calls for a broader conversation on how we move forward with a more sensitive, more aware, and more inclusive lens. One of the great things about this country is its incredible diversity, and that's clearly reflected in our food. Culture is not just the food we eat, but how we prepare it, how we eat it, how we value it, when we eat it, and just so much more. Our programs need to be reimagined in a way that recognizes and respects those cultural differences, and that starts by listening. We must spend more time with those with lived experiences with our programs to ensure what we do and how we do it is actually helping all of those who rely on our services, meeting them where they are and doing it in a way that helps promote equity. It's a part of an overarching commitment that USDA and I share, and one that's supported throughout government all the way up to the president. On his very first day in office, the president signed an executive order titled "On Advancing Racial Equity and Support for Underserved Communities Through the Federal Government." And it called on federal agencies to identify any programs or policies that perpetuate systemic barriers for communities of color and other underserved groups. And at USDA, we believe this is a vital commitment necessary to building back better as a nation. It's really exciting to see our SNAP-Ed partners have embraced the vital role that the program plays in advancing racial equity across government. Your agenda today, and of course, for all of our work together throughout the coming year, is ambitious and promising. And really, these conversations about embedding equity into the work that we do, it couldn't be coming at a more relevant time. The public health crisis has placed unprecedented stress on American households, leaving in its wake millions of families struggling to make ends meet. And this has been and continues to be an uncertain time with impacts that will last for years to come. Still, our goal couldn't be clearer: to come out on the other end of this pandemic in a better place than where we began. And that begins by looking within, and particularly on the race equity front. I want to be clear that at USDA, we acknowledge that we're just at the start of our equity journey, and we have a long way to go and a lot to learn from others like many of you represented here today. We're really proud of our efforts to meet the nutritional needs of low-income Americans, especially during these fragile times, but we know there's much more we can and must do to ensure equity across all 15 of our nutrition assistance programs and remove any obstacles to access for those in need. For far too long, Black, Indigenous, and people of color have faced discrimination, both overtly and through institutionalized practices. And further, we know that poverty and food insecurity is not a problem that's equally experienced. Food insecurity is disproportionately prevalent among marginalized communities, including communities of color, communities that are also similarly excessively impacted by diet-related disease, something you all know all too well. So like our 2020 through 2025 American Dietary Guidelines, we need to customize engagement through SNAP-Ed to reflect budgetary considerations and cultural traditions. Black and Latino adults are more than twice as likely as white adults to report that their household doesn't get enough to eat, a level of disparity that has been exposed and exacerbated by COVID-19 pandemic. But food insecurity is really only one side of this coin, one dimension of it. At USDA, we're committed to promoting nutrition security as well, the idea that all people at all times have access to a healthy diet. And nutrition insecurity is a complex challenge, one with lasting and negative consequences. Unfortunately, we know that communities of color are also at higher risk of nutrition insecurity and diet-related chronic diseases, which is of particular concern to us here today. USDA's nutrition assistance programs can help address these issues. In particular, SNAP is, of course, the most far-reaching, powerful tool we have available to ensure that all Americans have access to a healthy diet. And SNAP-Ed is a crucial part of our nutrition security mission. It strengthens the public health impact of SNAP by ensuring that folks using the benefit have information and the support they need to make their SNAP dollars stretch. How to shop for and cook healthy meals, and how to stay physically active. SNAP-Ed is an important pathway to helping our families lead healthier lifestyles, which is why it's all the more important that our efforts serve everyone fairly. The executive order I mentioned earlier charges us with examining disparities in our services among racial and ethnic groups, people with disabilities, and residents of urban, rural, and indigenous communities. This is a charge that we welcome. So our goal, together with you, is to pinpoint where those populations may be under-resourced and how they're underserved in order to best plan, implement, and evaluate programming in this space. Today's meeting advances that conversation. By viewing SNAP-Ed through an equity lens, we can more acutely strategize and better engage those in need so that everyone, regardless of background or where they live, can reach their full potential. The solution's very likely going to be complex and will demand a lot of self-reflection. How do we embed fairness in our decision-making process? Where have we contributed to the inequities that exist today? Where are we falling down? What can we do to improve delivery? Or even how do we better stabilize lives that have been turned upside down? As we seek to answer those questions, USDA will need to actively seek out different perspectives, find those who engage with, are impacted by, and rely on our programs, and use their feedback to guide our next steps. And we need to learn from each other, sharing challenges, best practices, and lessons learned along our path to exposing and tackling systemic issues. So I really want to stop and pause and say thank you all for your leadership in this space. We at USDA have a lot to learn from this community, and I'm committing the agency to approaching that with humility, and with really open hearts and minds, because we want to hear what you have to tell us so that we can all improve. So working together, we will make strides in fighting food and nutrition insecurity. We will work to address entrenched inequities, and we will build back better. So many thanks to the SNAP-Ed Toolkit team and ASNA's Race, Health, and Social Equity Committee effort for starting this dialogue. And I really look forward to many more discussions like this down the line. Today is very much about advancing and celebrating equity, but it's also about celebrating you, our partners, for improving health outcomes for every American. So thank you all and enjoy the webinar.
Thank you so much, Stacey. So appreciate you being here with us. We're going to move on. I'm going to introduce briefly our three speakers for the coming time. Latrice Davenport is the SNAP-Ed coordinator. She's with Georgia Department of Human Services. Stephanie Parker is co-founder of OKTEP, the Oklahoma Tribal Engagement Partners, and serves as their evaluation and program design director. And Mary Marchek is the director of Urban Family Development and Evaluation with the University of Minnesota Extension Center for Family Development. And all three are members of ASNA's Race, Health, and Social Equity Committee. Latrice?
Good afternoon. Thanks so much for grounding us in that conversation, Molly, and thank you so much, Undersecretary Dean. Thank you. So we're going to start with some terms that we'll use throughout the webinar. These are ones that we have used in some capacity, and we might have others where we're kind of working on them and still developing what they may look like for SNAP-Ed. So I'll start with racism from Dr. Kamara Jones, which is a system of structuring opportunity and assigning value based on the social interpretation of how one looks, and unfairly disadvantaging some individuals and other individuals and communities, and saps the strength of the whole society through a waste of human resources. And it really, this definition in particular really points out the kind of assignment of value and implicitly the power. And that'll be really important as we talk about equity. And institutional racism is often evident as inaction in the face of need. And so even for example, race neutral policies, there might be disparate impacts, and those are opportunities to look at processes, practices, and the culture of the institution to examine where those disparate impacts might have a root cause. Next slide, please. So racism can be internalized, interpersonal, institutional, or structural. And each of them has an opportunity for us to address them. So internalized, those lie within yourself. Interpersonal really plays out between interpersonal relationships where you're bringing your own private biases into interactions with others. Institutional racism occurs within institutions, and it typically involves discriminatory treatment, unfair policies, practices, cultures that are also based on race. And structural racism is bias across institutions and society. And some strategies to really address for internalized racism is support groups, racial healing, mentoring, counseling, education, interpersonal, cross-cultural dialogues, relationship building, affinity groups, institutional racism, practices, and I would also include cultures, and examining how that affects outcomes for the people that we serve. And I'm choppy now. I'll turn off my camera. And really highlighting and ideologies than multiple institutions. Next, please. Oh no. Okay. Molly, can you hear me?
Yes.
Got it. Okay. Issues. And so throughout the presentation, you'll also hear the term whiteness. I just want to make sure we're clear that it is an ideology or belief. Belief, values, or behaviors or habits which could result in unequal distribution of power based on skin color. It does not mean or require that most white people actively or consciously remains the implicit standard of me. This leads to marginalization and othering. Slide, please. And this is a chart from Bread from the World, applying race, and it walks through some of the ways that structural racism affects food insecurity for Black, Indigenous, and people of color. Okay. Do you want to take over, Ollie? I'm really choppy. Can you hear me? Okay, now you can hear me. Okay. All right. We wanted to pivot to health equity and really centering equity in our conversation and making sure that we're grounding this conversation in what we are working. This is our working definition. So for health equity means that everyone has a fair and just opportunity to attain their full health. It really emphasizes shift in power in systems and requires a removal of systemic barriers to good health. Next slide, please. And so I want to make sure that we're clear that equality and equity are a bit different, whereas equality means everyone gets the same access for the same resources. Equity means that we have a fair and just opportunity to access what people need to thrive. And so that may mean that we need to determine the needs of each community and allocate resources accordingly. So it's not a one-size-fits-all model. It does require a more engaged conversation with the folks that we serve. Next slide, please. And we are focused on both a process and outcomes. So for process is more of like how we do our work. What are the unique needs of the community? What role does community members play in the work that we do in determining where resources are allocated? Who determines what's successful? And outcomes is really answering the question, are there material gains for the local community that we serve after we leave? At the conclusion of our programming, did we facilitate the change that local community members wanted? And so those are some questions that we can ask ourselves as we are determining how our programs can better center racial equity. Next slide, please. I just want to make sure that we are, clear that what we're not interested in doing is closing gaps, so to speak, or equalizing subpar results. Our goal is to not just eliminate gaps, but to increase the success for all groups, because we know that if the systems in place aren't working for Black, Indigenous, and people of color, it's very likely that the system doesn't work for anyone else. And so really determining where those root causes are, what's causing poor health, what's causing poor access to healthy eating and active living, really gives us an opportunity to address those root causes, either through direct programming or through partnerships. Next slide, please. And so here are some guiding principles I've used, and I have, these are also some that have been shared with me through with committee members, but really looking at, ensuring that we approach this work in a way that the people that we serve are really the experts of their own lives, that we are accountable to the communities that we serve. So transparency is really important. That we start with the opportunity or with assets and not with deficits. And that we and that people that are most harmed from disinvestment, discrimination, and disenfranchisement are in the best position to inform solutions. There are, of course, more, but those are some that I've been collecting from committee members and through my own iterative work. Next slide, please. My apologies for my internet access. Okay, so we will share two examples, one from a major university and another from a social service organization. And I will turn it over to Mary Marchek.
Mary, you're muted.
Yes, it's only been like 20 months and we haven't quite figured that out yet. But thank you for letting me share about the work happening in Minnesota SNAP-Ed, in particular, the University of Minnesota Extension SNAP-Ed program. Next slide. During the time when Minnesota was at the epicenter of our nation's reckoning with racism, following the murder of George Floyd, and in the middle of the pandemic, many of us were really struggling with the question, what can we do? And in October, during our first all virtual extension program conference, as a keynote, our dean interviewed Sarah Bellamy, president of the Penumbra Theater Company in St. Paul. The theater company creates, and in their own words, professional productions that are artistically excellent, thought-provoking, relevant, and illuminate the human condition through the prism of the African-American experience. And they do a lot of training and work on social justice. So when she was asked, what can we do to address racism? Sarah's answer was both stark and simple. Live out the 3 A's. Become aware, learn about the issues, open yourself up to understand deeply. Acknowledge that systemic, institutional, interpersonal racism exists, not just as a theory, but in spaces where we live, work, and play. And then act. Because if you do nothing, you are part of the problem. And you need to do all 3 A's. Because knowing and even acknowledging without action can't bring about the shifts in practice that we need for change. But actions without awareness and acknowledgement can actually do more harm than good. So next. So I'm going to be couching my presentation today in the work that we've been doing in Minnesota SNAP-Ed in some of the awareness activities that we've been involved in and acknowledgement and actions. I'll share a few ways that we have tried to become more aware for deeper understanding. Next. So in addition to our takeaways from Sarah Bellamy, in the spring of this year, we invited Dr. Kamara Jones at Latrice utilized Dr. Kamara Jones' definitions as a foundation to today's topic. We invited her to our 3-day SNAP-Ed sponsored conference titled Healing Minnesota. She uses allegories to explain why privilege is so hard to see for those who are benefiting. She uses, for those of you who are gardeners, she uses a gardener's tale and talks about how racism and white narratives get perpetuated and universalized over time. She uses an analogy of the cliff of good health to explain how systemic racism works in public and individual health. She is all over YouTube, so you can learn from her at any time. Also, if you didn't get a chance to learn through this amazing webinar on white narratives in the food system, presented just last month by a team at the Duke World Food Policy Center, Try to get a hold of the recording and view it. It was fantastic. There's so many opportunities for us to learn and to become more deeply aware. Next. One day, a book showed up in the mail, a book co-written by Oprah and Dr. Bruce Perry called What Happened to You? What Happened to You? A Conversation on Trauma, Resilience, and Healing. Now, I have this little thing about Oprah that I'm trying to write something that will get me in front of her. That's one of my bucket list. But Dr. Perry is a brain and trauma expert who studies how the brain works and develops under trauma conditions. It formed the basis for their call for a subtle but important shift in how we see or we may see our participants by asking the question, what happened to you, rather than what is wrong with you? Related to this, our own Indigenous colleagues, Susan Bullio and Brianna Michaels within our own center, who are experts on cultural healing, taught us about the NEAR sciences, N-E-A-R sciences, where N stands for neuroscience. So how, just like Dr. Perry, how the brain develops under trauma. E stands for epigenetics, how trauma can be passed down through the generations. A stands for ACEs, adverse childhood experiences, and R stands for resilience. And those four sciences together, integrated, provide a pathway for understanding historical trauma, healing, in ways that we can better support Indigenous communities. Next. As we turn the dial to acknowledge, just becoming aware without deeper reflection and honest look at ourselves and our programs will be wholly inadequate. Next. One of the ways that we acknowledged how racism shows up in our department and in our program last September in 2020, our center's associate dean, Dr. Trish Olson, and myself invited all Center for Family Development staff, educators, and faculty to tell us how racism shows up at our center, in our education and programs, and what we as leaders can do to support racial equity. In all, we held 15 conversations with nearly 80% of our 120 or so members. These conversations unveil the hard truths that we had to acknowledge, the many ways in which racial inequities showed up in our workplaces. For example, approximately a quarter of our direct delivery staff in SNAP-Ed work with Latinx communities, and most are native Spanish speakers. And they told us of their embarrassment from being out there as part of a large land-grant university without effective, quality educational resources grounded in their culture, in their language, nor a place on our website where they could send partners and participants for additional resources. They told us about racism experienced at the hands of peers, partners, and sometimes even participants. But most importantly, the exhaustion of the multiple layers of translating, adapting, cultural nuancing work they've had to do up and down the system. In essence, they were doing double the work of their white peers because of who they are and who they are asked to work with. Next. And as we learned more deeply, we continue to ask questions. How do white narratives and inequities show up in our program, in our staffing, and how we narrate our work? And it's not just about community engaged work out there without doing the work internally. Next. Dr. Kamara Jones and the presentation by the Duke World Food Policy Center showcase potentially how white narratives may show up in our SNAP-Ed work. White narratives around individualism show up in a way that programs emphasize personal responsibility, a belief that individuals should be able to solve problems and accomplish goals all on their own. We do this a lot with direct education only. And the message is, if you would just know better, then you will eat healthy. If you would just work harder, then you would be able to feed your family. And even in our PSC programs, we evidence paternalism, a sense that BIPOC communities cannot take care of themselves. We know the best way to help. We have decades and even centuries of research and development that backs up the solutions we bring. So we don't need to know what you think or believe or learn about your experiences. Dr. Kamara Jones says health programs often take an ahistorical stance. Forget the past, deal with the realities now. Yes, over centuries, we've systematically stripped you of your culture, your foodways, and removed your children to take away your ability to socialize your own and role model your values and norms. But forget all that. That's in the past. So let's talk about how to eat more fruits and vegetables today. According to Dr. Jones, not dealing with whole health, including historical trauma and mental well-being in meaningful ways, we are taking an ahistorical stance in our programs. Exceptionalism or universalism defines what is good and what is bad, good food, bad food. And in this case, white culture norms and values become normative and natural and the best way to be. They become the standard against which all other cultures, groups, individuals are measured. And if you don't measure up to that standard, then somehow you are lacking as an individual or community. All these narratives do not work in isolation, but they work together to perpetuate white narratives in our programming. Latrice named some of the questions that SNAP-Ed as a program should be asking. In addition, I will say, ask questions about where did the curriculum or program model come from? Who developed them and for whom? Who most benefits from the program for real? Do we care more about numbers to put on the EARS report or how people are faring in our programs? Do we care more about keeping funding or continually improving for deeper level impacts? Answer these questions for real. How many opportunities and how much time are BIPOC communities given to explore their own solutions and identify promising practices? Recall that we've had decades and even centuries with loads of resources to do research and development in white spaces. And yet, we expect the same results through one-time initiatives in BIPOC communities. Next. Now for some of the actions. And I will say to you, our actions around racial equity in our program is facilitated by the fact that the importance of racial equity is embedded in all layers of Minnesota SNAP-Ed programs. Next. And it starts with our state agency, Minnesota Department of Human Services. They relay the importance of sovereignty of our tribal nations by contracting directly with 8 tribal grantees and a tribal agency to support PSC. Then they connected all of us to develop a shared vision and processes. And in this and in many other ways, our DHS partners set the tone for addressing racial equity in Minnesota SNAP-Ed. Next. And as an implementing agency leadership, we took cues from our funder and our tribal grantee partners to take action around racial equity. I talked a little bit about in the section on acknowledging, I shared about the concerns expressed by our Latinx staff. Over the past 10 months, we hired a Spanish fluent web and resource designer. We connected the team to a native Spanish speaking evaluator. We contracted with a native Spanish speaking videographer. We hired a culturally grounded educational resource development specialist and as well as a native Spanish speaking supervisor. But it's not enough and we get that. And these are just our starting points. We have been working hard to recruit, hire, and retain BIPOC staff. Currently, about 40% of our 120 or so members are BIPOC. More importantly, though, we are building a critical mass of staff representing BIPOC communities, so they're not isolated and working alone. There is power in numbers. We currently have 9 staff representing Indigenous communities, 15 native Spanish-speaking staff, 10 staff members representing African American communities, and we're building a small but powerful group of people around Hmong, Karen, and Somali, and other more recent immigrant communities. And even during the pandemic, when the university institutes salary and hiring freezes, we have worked hard to explore compensation issues and explore pathways for people to move into P&A, educator, and supervisor positions. As well, training all staff, managers, and campus administrators, and sometimes even partners on ways to do more equity work. We have trained all our staff on trauma-informed practice, facilitation to support powerful conversations around food justice and food access, other types of group facilitation processes, mental health first aid, cultural healing, motivational interviewing, and participatory methods and processes. Okay, the saying yes to scary things, that's the hardest to do. But just an example is an initiative started by several of our extension educators led by Noelle Harden called participatory grant making. We don't like to put, as a university, give money out to other communities. So the general idea for the participatory grant making is to bring diverse community participants and give them resources, money resources to live out their own solutions. And as part of the process, participants explain their solutions to each other. And through several rounds, they can grant some of their funds to someone else's projects that they deem deserving of more funds. You know how hard university systems makes to give money away without a 50-page contract with scary language and some formal grant process that are reviewed mostly by white academics. So this was a scary yes, but it turned out to be powerful and wonderful. And the team is beginning to publish on this work, so you should be hearing more about it in the future. Next, this is the last one. Our staff who are in the community have deep understanding, and they're with us because they have deep understanding and lived experience in the communities that we serve and work with. So how we want to show up in the community using an equity lens, we need to practice with our own staff. Our staff are beginning to have voice in how we do our programming. They are leading statewide teams, and they're able to be part of affinity groups that are together, race groups, ethnicity groups, and other groups without fear, and more importantly, with resources. Next. So I gave you a lot. Just part of the things that we're trying to do in our University of Minnesota Extension SNAP-Ed programs. And if it feels daunting to you, I'm throwing a lot out at you. I just have to leave you with this one thought. My formative years were spent in South Korea, and across many Asian cultures, there is a saying, and I brought this with me to the US. And the saying is something like, no matter how far the destination and how difficult the path seems, you will never get there if you don't take your first step. So I will leave you with that. Thank you.
Thank you, Mary. Oh. So, as a wrap up, Mary really provided some levers that you can utilize in your agencies, whether it be affinity groups or looking for an equity framework and really aligning institutional practices with those. So I will move to our next presentation by Stephanie Parker.
Thank you, Latrice, and thank you so much to Mary and the previous speakers, and to Undersecretary Dean for really laying out what's happening currently. And I do see that this is a very important time, and that SNAP-Ed has such amazing opportunities. And I know there's so many more of you who are out here working towards and striving towards health equity. And I wanted to share too that as I am sharing information about Oklahoma Tribal Engagement Partners and how we have organized and the work that we do in coordination with tribes is based on many experiences, not just mine alone. There are many folks that are not here today presenting, but that have strongly influenced this work, and you will have an opportunity hopefully to be introduced to them a little bit on some of the later slides. I do also want to set the stage a little bit to let you all know that in Oklahoma, we do have 4 implementing agencies. There are 2 that you might call tribal serving IAs. That would be Oklahoma Tribal Engagement Partners, as well as the Chickasaw Nation. And then we also have 2 IAs in Oklahoma that are housed, for lack of a better term, as part of universities, both Oklahoma State University, as well as, which has cooperative extension services, as well as the University of Oklahoma. And so today, what I will be talking about is specifically in relation to Oklahoma Tribal Engagement Partners. Thank you. Next slide. And so as part of SNAP-Ed, the guidance, FNS has been requiring states to consult with tribes. And today I'm going to share some of our practices that have helped inform SNAP-Ed in coordination with tribal partners. Now this particular statement from this article that I'm sharing with you all has rung true since 2006 and before. When I was first introduced to this statement, I thought this is exceptionally relevant to the work that we do with SNAP-Ed. And I haven't been able to take it out of my slide deck since 2006. But anyway, what's really important here is for us to think about, to be mindful and deliberate in our attention, not only to nutrition and health issues, but also it's very important to have a better understanding of social, cultural, historical, and political environments within which our work is taking place. Now, we also have to take into consideration that it takes a great deal of time, not only to understand the social, cultural, historical, and political environments, but it also takes a lot of time to be able to build effective working relationships. And we have to be committed to spend that time, to know that as we're spending time to develop authentic relationships, that we can transition to authentic programming that lifts up cultural relevance and addresses issues of racial and social injustice. Next slide, please. And so at Oklahoma Tribal Engagement Partners, we have found that a synergistic as well as a flexible approach is essential to be able to carry out programming in coordination with tribal partners. Of course, we always have the SNAP-Ed guidance that lays out the requirements and approaches for SNAP-Ed, but there are many other factors for us to consider as we are working with tribes. There are funding mechanisms to consider and reimbursement procedures. And it's important for us to have these conversations early on so that we can figure out the best pathway to working in an equitable way. We also have to consider that there are varying and approval processes, varying and many approval processes to be addressed. And these approval processes will have an influence on our timelines that we propose and the overall work that can be accomplished in our time frame for the grants. And so it's important for us to be flexible and to recognize that a partnership with one tribe is not necessarily going to look or be the same as a partnership with another tribe. And so at Oklahoma tribal engagement partners, we also have, in addition to approval processes as part of collaborations with tribes, we also have to consider our work in coordination with IHS IRB, Indian Health Services IRB. And as well, because we are also being intentional to be inclusive with culture and language, we have language departments as part of tribes that we also need to work with and attend to make sure that we can really lift up culturally relevant approaches. And so we have the guidance. We work with, it's important for us to see what are the tribes' mission, the visions, and the core values of tribes or departments within which we may consider forming partnerships or fostering partnerships. And finally, as Mary was discussing previously, and not finally, but another important part, is that we need to make sure that the organizations where we're located, whether we're at a nonprofit, a social service organization, if we are at a university, that we need to make sure that our organization complements and supports the mission, the vision, and the core values of the partners with whom we're working. Next slide, please. And so our team has quite a bit of history in working with SNAP-Ed over the years. And in 2017 is when we decided, realizing the importance of, in Oklahoma, there are 39 tribes, federally recognized tribes, and realizing the importance of extending SNAP-Ed to more tribes throughout Oklahoma. In 2017, our team realized the need to work with more tribes and institutional barriers that would impede our work. And so that we combined our experiences working with tribes, our lived experience, our SNAP-Ed experiences, and we formed Oklahoma Tribal Engagement Partners. And I wanted to share two quotes from individuals who I think are really relevant to the overall work that we have been doing together. And one is from Teresa Jackson. I'll bet many of you out there know Teresa. Teresa is one of the co-founders of Oklahoma Tribal Engagement Partners. She is also the incoming ASNA, or one of the ASNA co-chairs. And at one of our meetings, not too terribly long ago, Teresa said, equity is a lifestyle. And that just rang so true and just perked my ears up. And I thought, I can't agree more. And so what we have been doing as part of Oklahoma Tribal Engagement Partners is to work to infuse equity principles as part of our everyday practice. And a little later in the presentation, I hope you'll be able to realize some of those everyday practice steps. And then we have the most wonderful Bobby Sankey, who was my first time that I had ever worked with a tribal IRB. And he was exceptionally helpful in taking us through the steps of going through a tribal IRB, and has remained a wonderful partner to this day. And one of the things that he said is that we make relationships with people, not organizations or institutions. And to me, this has always been such a profound statement, because it means that just because someone works with an organization or an institution doesn't open the door for free reign for everyone to work, to say, oh, well, just because Oklahoma Tribal Engagement Partners is working on this project doesn't mean that we have to consider that the characteristics, our characteristics on an everyday life, treating equity as an everyday lifestyle is really important. Next slide, please. Okay, warning. This is a model in progress. So this is based on our experiences. This is based on what we have been working on. We've taken our combined experiences to develop a community of practice model that infuses equity principles at multiple levels of influence. It somewhat resembles a sociological model, And we are looking to develop our model of practice that attends to racial and social justice as part of our programming and part of our partnerships. We approach relationships using the guiding principles of our most wonderful colleagues, Dawn Satterfield and Lamira DeBruin, who have worked extensively with the Native Diabetes Wellness Program at CDC. And so as part of our everyday processes, it's very important for us to not only to consult tribal leadership, but also Native American families. It's important for us to understand and embrace the importance of listening, the importance of respecting, and the importance of integrating Indigenous knowledge. It's important for us to lift up and honor tribal processes and to make sure that tribal core values are at the center of the work that we are doing. It's also important that we operate with integrity and generosity, and that we recognize the importance of respecting the power of words and also keeping our words. So this model also recognizes that there are many influences on health equity in Indian country, and that the importance of addressing these influences collaboratively and in a way that centers tribal partners' concerns at the forefront are essential. So OKTEP aims to supplement, complement, and support the work of tribal partners and community leaders. And our equity in Indian country, and our model of practice also recognizes the importance of culturally relevant programming as a pathway to health equity. And we work in coordination with tribes to facilitate the development of culturally relevant SNAP-Ed programming and to support PSE change efforts that are relevant and support the core values of tribes with whom we are working. Next slide, please. So additionally, a core tenet of Oklahoma Tribal Engagement Partners is integrative leadership. And we're having conversations here. So these are some aspects that our team has found to be helpful in terms of thinking of integrative leadership. So as part of integrative leadership, our organizational locus of control is both internal and external. So within the organization, integrative leadership is nurtured by our shared responsibility with respect to programming directions. So it's not OKTEP that determines all of the programming directions. You'll see later on that our partnerships look a little bit different depending on the tribe that we're working with. And we recognize that although our position roles may differ, that everyone within is considered a leader. We work to nourish leadership roles. We also work to nourish leadership roles among youth who participate as part of the programming. Back in 2010, when we began developing the Eagle Adventure in coordination with our Chickasaw Nation partners, we designed the program in a way to encourage youth to become health leaders with our change agents within their family. The location of positions in programming is also important. So depending on the nature of a partnership, an educator could be located at a tribe, or if the educator is working with multiple tribes, then we need to consider the best place for the educator to be housed. Additionally, as part of our organizational processes, we embrace an equity lens, and we work to develop a shared equity lens through human and equity-centered practices to enhance those practices through shared learning. Last year, our team engaged in a series of equity discussions and began around July, and I think we ended in December. And we took the time to have discussions and readings to enhance our overall understanding of racial and social injustices. And finally is our attention to language, not only in the workplace, but also in materials is very important. Our nutrition and health language can also oftentimes be very combative and derogatory. We attack problems. We address the obesity epidemic. We give population groups grades like C's and D's and F's in relationship to their health status. And so when working with an equity leading lens, it's important for us to use language that supports strength and resilience. And so that has been very essential for us, as also considering that the language that we use is not hierarchical, combative, or patriarchal as part of our everyday practice. And we also take this in consideration with respect to our development of materials or adaptation, and even the selection of materials. Next slide, please. This is another model in practice, in process. This gives you an opportunity to see kind of how we are organized. On this slide, we've been able to establish relationships or MOUs or LOAs with tribal partners that are over here in the far right circle. And you can see that there are quite a few tribal partners with whom we've been working. And so following the establishment of those agreements, whether it's an LOA or an MOU, we work collaboratively to hire community nutrition educators. And so at this time, we have 6 of 8 positions that are housed with tribal partners, and 2 one who's housed in Stillwater, and we have an open position for an intertribal educator, and would love if you all out there, if you know of anybody who's interested in working in Oklahoma with OKTEP and tribes, we'd love to for you all to help us recruit there. But you can see that we also work with numerous organizations, partner organizations, and we're also thinking about what are those partner organizations' core values? Do they fit up? Do they match up with the overall SNAP Ed programming work? And before I also wanted to see here then we have the OKTEP interdisciplinary team. And here you see many folks with also varying degrees and backgrounds. We have folks who with a public health background, registered dietitians. I'm a nutritional anthropologist. We have communications folks. We recently had the opportunity to hire a farm to community coordinator who actually has an RN background. And the same is true for community nutrition educators. There's just a vast amount of experience from an exercise specialist background. We also have just varying kinesthesiology, I said that wrong, but varying degrees. But also, as I mentioned previously, we also are guided by externally funded projects. We have the tribal administration, we have IHS, and OASIS is our professional employment organization. And as part of that, as we're organized, that all of what you see here in the OKTEP interdisciplinary staff and the community nutrition educators are human resources are run through the professional employment organization. So essentially, we're all employees of Oklahoma Tribal Engagement Partners, from community nutrition educators to the OKTEP interdisciplinary team, but we are housed and located in different areas. And for all purposes, the community nutrition educators who are housed with tribes are more or less employees of that tribe, although you don't have you're housed, not an employee, you're housed as part of the tribe. Sorry if I'm not doing a good explanation there. Let's move on to the next slide, please. This slide, I just wanted to show you a quick look that you can see that we have different, depending on the tribe that we work with, that it's not a one size fits all approach. And as you can see that we have collaborated on different programming, and some tribes we have a letter of agreement, and sometimes we have a memorandum of understanding. And at this point in time, the letter of agreement is for our work with that intertribal educator is working with who is Presley. I don't know if you saw her name before, but it's Presley Thorne. Next slide, please. Okay, something else that's important for us to consider are the role of colonization and the influence of colonization on indigenous peoples. So Waziatowin and Michael Yellowbird had in this article, they talk about colonization as a process that is perpetuated after initial control over indigenous peoples. And they say it's achieved as a result of invasion and conquest, and that colonizers are able to maintain or expand their social or political and economic power. And that as a result of colonization, as has been talked about previously today too, is that there's been the loss of land, forced assimilation, and historical trauma. And in fact, most of today's health inequities can be attributed to colonization because it's an all-encompassing presence. So decolonization is more of an act in terms of decolonizing our thought processes. It's a meaningful and it's an active resistance to the forces of colonialism that perpetuate subjugation or exploitation of minds, our bodies, and of lands. And first and foremost, it's important for us to think about a decolonizing lens. And the first step to decolonizing our own minds is to work in areas of truth and justice. Next slide, please. So as you can see on this slide, I think that I wanted to pose some food for thought related to how we can address health equity across SNAP-Ed. And many of you out there are already doing this work. And I don't want to give the impression that we have a magic potion or that we have found the ticket to health equity. But I see the most potential for attaining health equity as part of our evaluation strategies. It's important, and I would really love to see us spend as much time on our formative and process evaluation processes as we do on our outcomes and impact evaluation processes. So for us, as we have very much utilized formative and process assessment, and we consider using or have used methods that might be more decolonizing leaning. And so I wanted to just touch on a few things that I've pulled out here. And our overall, as Mary also said, that we have the Western science, we have the research rigor, but oftentimes there's been little attention that's been paid to that ecological rigor. And that ecological rigor is one that pays attention to cultural, social, and historical influences. And it also means taking an emic approach, which has also been talked about. Latrice just came on board talking about it when she first started speaking. But this emic approach means centering our work in the social and cultural concerns of families with whom we're working. So we need to work to have an understanding of what is influencing families' choices. And visibility is really important as a decolonizing approach. And visibility has been described as one of the strongest forms, most hurtful forms of racism, because when we are invisible, then we don't feel valued. And so program sustainability and equity can be better achieved if we pay attention to participants' perspectives, taking into consideration social and cultural contexts, working to increase visibility, which would help us have program sustainability and work towards health equity. Next slide, please. And so when we incorporate decolonizing approaches, like on the previous slide, we're able to lift up cultural relevance and support indigenous models of health and wisdom. As we center our formative evaluation on decolonizing approaches, it enables us to have a better understanding of those social and cultural influences on health that inform our programming. And so we're looking for opportunities to create a new narrative, to talk about strengths, resilience, and contributions of Native peoples. And when we do this, It helps to lift up Indigenous models of health and Indigenous models of knowing. And so what I'd like to do now is to share a couple of PSAs with you all. And this is as a result of attention to formative assessment and human and equity-centered practices. And I hope that as you all view these, that you can see some of the discussion points that we have talked about today and how they have been operationalized as part of our programming. So there's a lot of work to do. We're still learning. We don't have all of the answers. And today we're sharing some of our experiences from Oklahoma Tribal Engagement Partners. And I'm not going to be coming on back after this slide. It'll go back to Latrice, and we're ready to roll the video.
Thanks. Thank you, Stephanie. We're actually going to share the links to the video, make sure folks have them, but because of time, we're going to move straight to a wrap-up slide from Latrice, and then we want to have some time for everyone to do a little bit of reflection. So thank you, Stephanie. We're going to move forward. Latrice?
Yes, thank you, Stephanie. So as we wrap up, I just wanted to kind of reiterate some key points around how racism operates on individual, interpersonal, institutional, and structural or systemic level. It's really important within your organization or institution to define what equity looks like, and let that, and to start establishing guiding principles, include a shared framework for equity, building organizational capacity through TA trainings, discussions with your colleagues, and really centering community members in decision-making and ensuring that we are kind of co-creating solutions and really transferring power. Thank you again for all of the panelists, and I'll hand it back over to Molly.
Thanks, Latrice. Oh, thank you so much for hanging with us. We're going to move to doing a little bit of reflection. We have some questions for you. You can see them on the screen. I'm actually going to unshare my screen so we can do the polling again. We'll see how that goes because we really want to hear back from you. Like we said in the chat, we will be making sure all of your questions are answered, but it will likely be after this. We may not take the time right now to do that given where we are, but let me, oops. So here's, you can see the poll question to ask some reflection. Curious what is resonating with you, what's challenging you. We will share the reflections with y'all so you can look through them all at your leisure too. Thanks, y'all. These are great reflections. Are there more coming in?
Yeah, do you want me to move on to the next question?
Sure, we can do that. In the interest of time, yes, let's do we have our second question about what practices should we be thinking about when we're doing this work. Are we able to show that poll? The last poll, are we able to show that one about practices that people need to keep in mind, want to keep in mind? Yeah, we put the poll link in the chat in case anybody didn't get that, and we can show it back again. Looks like perhaps it's not. Sorry, I'm seeing in the chat that's just to the hosts that the poll is maybe not working.
I'm sorry, I lost my Zoom for a second. I'm so sorry. Give me 1 second.
It's what happens. Thanks, Yvonne. If y'all will bear with us just a moment, we'd love to see your answers and we'd love you to be able to see each other's.
Okay, it should be working now. Please let me know if otherwise.
Thanks, Yvonne.
Yes.
Thank you all.
Would you like me to also do the next question, Molly? We have time for that one.
Oh my gosh, yes.
Okay.
Yes, Yvonne, thank you.
Yes.
Yeah, y'all, we're also very interested to know what other topics you'd like us to cover, because like I mentioned at the top, we will be doing at least 3 more of these over the coming year with our SNAP-Ed Connection, ASNA, and Toolkit partners. So the last poll is just to ask y'all, what else would you like to know? What else should we cover? What can we learn together? What can we share? Thank you. Thank you for sharing these things. We may have unshared the poll, but if y'all have other things, please do continue to put them in there. We're very interested to know that. We will share out the topics. We will share out their reflections. We do realize that we're trying to pack a lot into this period of time, and we're over at this point. We did collect all of the questions, so we will be sending out all the questions with their answers to everybody, along with the slides and the recording. All of this will also be posted on the Toolkit website, on SnapEd Connection, and on the ASNA website, our new website when it gets up in October. So stay tuned for what we do next. I just wanted to thank everybody for being here with us. Remember that you will receive your CEU certificate if you're participating, or for those watching later, you will receive that. And just to wrap up, you know, we've heard a lot of important things today as we think about how to start the conversation on equity within SnapEd. And most important things are we have to try, and we know that we will make mistakes, but we have to try. Thank you, everyone. Thanks to our speakers. Thanks to people who kept our Zoom going today. And thanks for all of you for joining us.